So my name is Christina Hildebrand. For those of you who don't know me, I'm the founder and president of A Voice for Choice Advocacy. We educate, advocate, and empower people to know their health rights, mostly in California, but we do work on some federal bills, and we work with Stand for Health Freedom on a national level with their affiliates in each state. I just wanted to today start off with a overview of what we've been doing in the first part of this year, the first sort of 4 months of this year. And then I will take this as I usually do as a Q&A, and you're welcome to ask any questions you want as long as they relate to our mission statement and I know the answer to them. If I don't know the answer, I'll be completely honest and say that. So I'll get started. I just wanted, as I said, I wanted to give an overview of what we have been doing thus far. We've been extremely busy, and I write A Voice for Choice Advocacy here, but it does cover also A Voice for Choice and what we've been doing. The difference between those two organizations is A Voice for Choice is our 501c3, and we do primarily education there. A Voice for Choice Advocacy is our 501c4, which allows us to do lobbying and work in the Capitol. So this covers both of those things. We have an amazing team, very lean team, but they are amazing group of women who cover our legislative, our grassroots outreach, our articles that we write every week, and our social media. And so I'm thankful for their support, and your support, your donations is what pays them. So for anyone that's donated, thank you. So I just wanted to go through, as I said, I'll go through these in more detail, but what we'll cover is A Voice Unfiltered, our new magazine, which has been extremely exciting, as well as our articles that we come out every week, covering NonToxic Schools, which is a project of ours that we've been working on different aspects of creating non-toxic schools. Our new website, which is exciting. We're going to officially launch it next week, but I kind of wanted to I've given sort of glimpses of it. And if you've been on our website in the last few weeks, you'll have noticed it's different. Our bill, SB 1266, which Senator Limon authored for us, which bans bisphenol in children's drinking and soothing products, and then the 3 lawsuits that we have. So I'll get into this. We'll start off with A Voice Unfiltered. If you haven't received a copy of it and you'd like a copy, we actually sold out and we are getting more this coming week. So I'll put those up on the website. So if you are interested in it, it's a combination of 12 different articles that we have posted on our Substack and our blog over the past 2 years. It's nearly 2 years that we've been doing this. And the exciting piece of this, so we wrote this and put it together primarily to sort of have something physical that people could read and then give to their chiropractors, naturopaths, put them in offices, share them with people that aren't quite as, I'm going to say, awake as we are. And the way we write those articles really is from a perspective of kind of planting the seeds and opening people's eyes and giving them solutions to issues that fall under our mission statement, which is mostly to avoid toxins, to be informed, to know what's going in your body. We did deliver 120 of these to state legislators, to our state senators and state assembly members. And the goal for that was that they would see A Voice for Choice Advocacy and see the realm of issues and the broadness of issues that we cover, as well as understanding, possibly, hopefully reading it and seeing that, there are alternative or, integrative functional medicine ways of dealing with things, that you can. And, they may not get every article in here, but at least hopefully it would give them some insights that we are broader than just vaccines, which we're not really thought of as that anymore, but that we do have a lot of different aspects that we try to educate on. In order to see if you don't want the magazine but you do want to read our articles, we put one article out every week on Thursday. We have about 10 amazing writers and a managing editor. And I think, our goal is to put out, as I said, high quality articles that really give all sides of the story and give you solutions and not just fear mongering. I mean, I think probably the 2 articles which we sent out in the newsletter recently, but the 2 articles where we've really sort of were first at the table, or one of the first organizations to discuss it, was our article on appeal, which is covering the coating on grocery, on fresh produce, and then also an article on Produce Max, which is a spray that is sprayed on the sprayers coming out of the grocery, again, over the fresh produce, and the pros and cons of both of those. And so we've got some exciting things going on. I highly recommend either subscribing to our Substack or every other week we put out a email with our blog, what we've put out in the blog in the past few weeks. And those two things are the same. What gets posted to Substack is the same as what gets posted to our blog, other than for Substack, we do also supplement it with other articles from other Substacks or other publications, which I've read or other people on our team have read that they thought would be of interest to our readers. The next thing I wanted to focus on was non-toxic schools. And for non-toxic schools, this is sort of a sub-project of A Voice for Choice. We decided to brand it separately because we wanted to address, as the name says, getting toxics out of schools. And we wanted to kind of have a separate branding outside of the A Voice for Choice advocacy and the A Voice for Choice brand name to try and get this message across. On that website, if you go to that website, we have various ways that you can get toxins out of schools, but it also is a positive piece of it, of things like rainwater barrel collection, tree planting. We haven't got that up. That'll go up tomorrow. And then we're working on a major project on artificial turf and trying to get schools especially, but also towns to ban artificial turf, or at least to stop putting in artificial turf in place of fields and school soccer fields and baseball fields and football fields. And that one we're going sort of to a greater extent, and our hope is to do this on many different fronts, but is to really give parents the resources that they need to go to their school and either block a artificial turf coming in, or to or to educate the school before that's even a consideration. So that's a place where you can find those resources. As I said, the tree planting we'll have up tomorrow, and I will send an email out on that. The artificial turf is a work in progress, and we hope to have that in the next, I'm going to say probably month or so. Everything always seems to take longer than we anticipate, but that'll be the first. We hope to do the same for things like EMFs in schools and other pieces of that sort of toxic puzzle in schools. Our new website is something that I am super excited about. We had the same website since 2015. We also at that time had a separate website for A Voice for Choice and A Voice for Choice advocacy. We made the decision to merge those two websites into one website to make it, we still need to keep sort of the pieces of the website separate, but to make it easier to navigate and to have everything in one page so we're not updating two sites. I think the key pieces right now on this website are the legislation, the litigation, and the empower yourself pieces. I'm excited, and I'll go in when we go through the SB 1266, our bill. I'll go into sort of the details of the legislation site. But as you can see here, we have all the bills that we are sort of sponsoring and that we've inspired, that we are in support of, and that we're in opposition of. And you can sort those by each of those types of bills, as well as federal bills that we have. We don't, as I said before, we don't support or oppose many federal bills, but there are some this year that we've looked at and really wanted to expose or wanted to support. And so each of those, it's an exciting, and it's always up to date. We have our legislative director updating these bills so that you can go in there and see what you need to do as an action item, but also get all of the information on those bills and where the bill is at. On our litigation page, we have both our current litigation as well as previous litigation that our lawyers and that we have sponsored. I will go into more detail on what's happening in the litigation on the next few slides, but I wanted to bring it up that it is up to date on our website as well, so that you can go into that. And then the other piece is our empower yourself pieces of information that are areas where you can take action based on our blogs or our posts that allow you to sort of take power over your own rights. Things like locking your California Immunization Registry, and being able to access your children's medical records, religious exemptions. It also has things like buying non-toxic Christmas trees, those types of things. So this is the sort of main part of our website. We do also, of course, have the blog with all our articles on it, and you can sort those by topic so that you can sort of refine what you see. There are 2 pieces of the website that are not finalized that hopefully in the next, I'm going to say month as well, but that always may change, but hopefully in the next month we'll be up to date. One of them is issues. So those are the types of things like looking at vaccines and going into detail of each of the vaccines, looking at air pollution, looking at different toxics, those types of things that we'll focus on there. And then the other piece, which we are in the final steps of updating our website, is learning the California legislative process. So one of our team members has done an amazing job of putting together summaries of the different parts of the legislative process. So the California legislative process is very detailed and very complex and very, I'm going to say, confusing at times to work out where is a bill along the way, and when they say, it's in the rules committee, what does that mean? Or it's in a policy committee, or the governor, all the bills at the end in September go to the governor's desk. What are the options that the governor can do, and those types of things? And our hope is to really be a resource there for people if you want to understand the California legislative process, to be a resource for everyone in California to be able to understand that on sort of on a micro level. So moving on to SB 1266. SB 1266 is our bill that Senator Lamone is the author of, and it will ban all bisphenols in children's drinking and soothing products. So this is a bill, just to sort of recap, why does a Voice for Choice Advocacy want Democrats specifically, but all legislators, to author bills for us? We spend December and January what's called shopping bills, where we have a list of bills that we would really like to see come forward in the legislature that year. And we really want legislators to pick bills up. What that allows us to do is to have those conversations with legislators and build the relationships that we want to build. Of course, the topic of the legislation is really important to us. In 2020, we had a bill that Assemblymember Christina Garcia, picked up for us that labeled, as of last year, labeled all menstrual products. So menstrual products are considered medical devices by the FDA, and so they didn't require ingredients. And so now, because California had that bill that we brought forward and it was signed into effect, and New York did the same, and so in order to for the menstrual product producers, manufacturers, to comply with those 2 states, actually all menstrual products in the whole of the US now have their ingredients labeled on them because of that bill. In 2023, last year, we had a bill, SB 499, which was authored by Senator Menjivar, and that would have mitigated extreme heat and air pollution by putting more trees on school grounds and removing sort of the plastic and the hot surfaces, so asphalt and the crumb rubber that's underneath playgrounds and synthetic turf, in order to lower heat, cool the schoolyards, and also mitigate air pollution. Unfortunately, that didn't make it to the governor's desk because of budget reasons. Everyone knows we've got serious budget issues in California. And so this year we had, as I said, a wide variety of bills, and this one got picked up by Senator Lamone, and it is as I said, a ban on bisphenols. In 2012, there was a ban to ban BPA, bisphenol A, in all children's drinking products. It then went to a federal ban, and so that was great, except for the fact that manufacturers ended up replacing BPA with other bisphenols. So bisphenol F, bisphenol S, and bisphenol M are the popular ones, and those are just as toxic as BPA, as bisphenol A. And so our request is to have those banned as well, so that children's drinking and soothing products are safe for them to use. The picture on the bottom of this is where I get excited about our website. So if you click on any of those pieces of legislation that are under our 2024 legislation, what will show up is this. It's actually longer than this. It's a longer page than this, but this is the top of it. And it gives you the information on the bill. It gives you a bill synopsis. It gives you a link to the bill. And then on the bottom half of the page, it gives you action you can take. as well as our stance on it, our letters, if we have a letter that we've put forward. But it basically allows you to see what we're supporting or opposing. We will send out, if there are action alerts, we'll send those out via email. But on this, you can look up, what bills, what you can do. The other great thing with this website or this page on the website is that you can go in and look for your legislature and see what bills we're supporting from your legislature, so that when you go to their coffee morning or their, town hall meeting, there's something that you can tell them, well, thank you for authoring this bill, or this is a bill that, we have concerns with. We would really like you to do something different on it. So I highly recommend you going into our website for that purpose if you are going to meet with your legislature, so that you can see whether there's a bill that they've authored. And then finally, the last piece of this is an update on our lawsuits. So A Voice for Choice Advocacy has sponsored 3 lawsuits this year. We had some in previous years, but this year we have 3 lawsuits, an EUA product lawsuit, an SB 277 religious exemption lawsuit, and an SB 277 titer testing lawsuit. And I'll give you a brief overview on where those are at. If you do want more detail, I would recommend going to our website, and there's more details there. So our EUA product lawsuit, we went through the process and we're at the end of that lawsuit. What that lawsuit was to bring California. There is a code in the California statute that says for any experimental drug, it has to go through an approval process in CDPH, California Public Health Department, has to go through and the CFDA, the California FDA, has to go through an approval process in order for that drug to be sold, distributed, given away in California. And so our request on this was that any EUA products, so the COVID vaccines, the COVID tests, the COVID masks, all of those things that were approved at an EUA level by the federal FDA, needed to go through this process. And the statute was put in place in the 1980s when the HIV drugs were coming into play, and people wanted to be able to access them, even if they were only trial drugs, and to be able to give themselves a chance and take that risk. And so we believe, and we still believe, that California should have gone through that process for the COVID vaccines. And so basically we wanted to make CDPH liable for that, and that they had to go through the regulatory process. And, in the meantime, if we had won it, we would have said, you need to remove those products off the market until you do this. Unfortunately, we got a demurrer, which is a motion to dismiss on this case. And the reason for it was, and the judge agreed with it, was that there is no private right or personal right to sue the state of California and CDPH or any other entity that was selling or distributing these products. There's no private right to sue. We don't agree with it, but we don't see a way around it. What they're saying is the only people that can monitor that is CDPH itself. So it's basically the fox watching the hen house. And if CDPH says it's fine to sell or distribute these products when they're only EUA, then they can supersede that law. And there's no way that an individual can sue the state of California, sue CDPH. The only way to sue CDPH is by CDPH suing themselves, which they're obviously not going to do. And so we did take the judge's ruling on that, and we didn't see a way forward on this law given the statute. But it was a little frustrating because realistically, the fox watching the hen house on that one. Our other 2 lawsuits are in progress, and they're progressing slowly. Whenever somebody comes to me and says, I want a lawyer because I want to go to court and I want to get this fixed, I say to them, okay, do you have 2 to 3 years to do that? Because that's what it's going to take to get these lawsuits brought forward and fully adjudicated. Our religious exemption lawsuit is moving forward. We did get a motion to dismiss or demur. That was what we were expecting. You know, we didn't expect the state to just lie down and say, yep, sure, you can have religious exemptions in California. This lawsuit, SB 277, just a reminder to people, that was the law that removed religious and personal belief exemptions in California for vaccines, for the vaccine requirement for children to go to school. And so that was removed in 2015. And our request in this lawsuit is that a religious exemption be put back in place. We do believe we have a strong suit, but we do also anticipate that, you know, in California, it is unlikely that we succeed first round, and that it will have to go up to the higher courts. We are in the process of filing an amended lawsuit. Just to give you some background, there was another lawsuit in Southern California that was filed doing the same thing, and their lawsuit was dismissed with the ability to amend it. And in that, the judge very clearly laid out what needed to be amended. And so we actually pulled our lawsuit and said we would like a leave to amend, so we want to amend it, and so that we cover those issues, so that our case has more of a better case in order to succeed. So we are in that process of amending our lawsuit, and we will resubmit it in the hopes that it will be at least successful in getting in front of a judge. So that is the update on that one. As I've said many times, my guess is that one will take 2 to 3 years. Our hope is that, you know, I think we have the best case in order to be successful, but it just takes time. You know, we filed that case in November, December, and it's, you know, we're still not even in court. We won't be in court until at least July in that case. So just takes time. It's a long process. Our other lawsuit is SB 277, again, the vaccine exemption lawsuit here that deals with the exemptions. In this case, it has to do with titer testing, which is antibody testing. So if you have antibodies, the consensus sort of is that if you have antibodies, that you have the ability to fight that disease if it comes in contact with you. And this case specifically, there's a child who has a medical exemption. The medical exemption was revoked. The child had chickenpox and had other vaccines, and the parent and the doctor went through the whole process of titer testing. The child is immune to everything. The child had a reaction to a previous vaccine, and so the doctor put forward a medical exemption through the care ME process, saying that the child had either had at least one dose of the previous, you know, of the vaccine, and or in the case of chickenpox, had chickenpox and had antibodies for all of them. And so, you know, was safe to be in school. CDPH revoked that medical exemption and said, we need more information. So the doctor uploaded all of the medical records that showed all of this, and CDPH still revoked, said, you know, the appeal is not good. And so that child, according to CDPH, should be out of school. The child is still in school because the school sees that the child has titer tests, but because the child doesn't have an ME, a medical exemption, the child should not be in school. And so the goal of this lawsuit is twofold. One, to keep this child obviously in school, but also to ensure that if a child has titers, for whatever reason, if they've had the disease or if they've had a previous dose of the vaccine, that child can stay in school without a medical exemption. So just by showing, you know, the vaccine record and the titer testing record. And that is something that the UC system allows titer tests, and just showing the titer test results. And most other states allow some form of titer testing to be shown in lieu of vaccinations. And so that is our goal with that lawsuit. So those are our 3 active lawsuits. That's sort of the update of those. Again, you know, they just take a long time, and so we're working on them. They also take a lot of money. So if any of those lawsuits, or if the religious exemption lawsuit and the titer testing lawsuit, are something that you want to support, that's a place for donations. You can donate to either a Voice for Choice or a Voice for Choice advocacy. A Voice for Choice is the 501c3 where you get a tax donation, or a Voice for Choice advocacy, and those funds will go to our lawyers. We have amazing lawyers. They do reduce their prices for us, but they do charge us. And that was a decision I made. I didn't want to have pro bono lawyers because then your court case kind of goes to the bottom of the pile. So we're very happy with our lawyers, but they do cost money. They probably are our largest expense every year. So especially when we've got active lawsuits. So we appreciate donations. I'm going to go to the Q&A portion of this. I'm going to stop sharing my screen. So the first question, I'm going to put on my glasses because I'm getting old these days. I realized I need glasses. The first question I have is, we've locked our immunization registry, but who can still access and see the information in there and look at the registry? Schools, colleges, government, or only doctors? So it's an interesting question. So if you have locked, let me just sort of do a background on the immunization registry. The immunization registry is the California registry. Every state has their own registry. If you live in California, only your California vaccines that you get in California are input into the California registry. For example, if you went to Utah and got a vaccine, it would be input into the Utah registry, but every state has different laws around it. So in California, as of last year, beginning of last year, and we tried to fight this and we tried to get an amendment, but as of last year, all vaccines that are given in California are input into the immunization registry, the state registry. You do not have a choice of that. Of that, there is no way to opt out or opt into that system. So your vaccine records, if you get a vaccination in California, 100% as of last January will be put into that database. There is the ability, and that's where we differ from the other states. So most other states have either an opt-in or an opt-out, where when you get the vaccine, you can say, oh, I don't want my information in that registry, and they don't put it, your doctor doesn't put it in. Or there's a way to, after it's been put in, to opt out and to have all of your data removed, not just locked. And so in California, the only option is to lock your data. And what that means is that your data stays in the database, but it does not get shared. So if a school, for example, goes in or a college goes in and wants to query the database, if you've locked it, it says this person's vaccine records are not accessible. But your vaccine records are still in the database with your name or your child's name on them. And the people that can see them is CDPH. The California Department of Public Health has full access to the back end. They do share some of that data to on an aggregate level, being able to say, for example, during COVID, 70% of people got their first shot. 50% of people got their second shot, those types of things. So they can share aggregate data, they can't share personal data. If you want to know what data is there, you have to fill out a form, you have to show your ID, and they will download and tell you what information is there. If you want to lock your data, you also have to put in a form, and they unfortunately don't respond to you, or most of the time don't respond to you saying, yes, we've locked your data. But I would recommend there's a email address at the bottom of the form. If you email them and say, could you confirm that you got my form and that you did lock my data, and they will write back to you and say, yes, we got that. And they're usually pretty quick to respond on that. So it is, the answer to this question is, and your doctor can see it. Your personal doctor can go into the care database and see what vaccines you've had. Okay, next question. Will the tighter lawsuit take 2 to 3 years as well? So this child is actually moving schools at the end of this year. And so we are really hoping that there is they're staying in the same school district, so that we're really hoping that there is some form of adjudication, and the lawyers are working together, both sides, to come to a resolution. We have said what we need in order for this lawsuit to be resolved. They don't see an issue because the child is still in school, although the child is, on a legal level in school, should not be in school because they don't have medical exemption and they don't have the full vaccinations. But we'll see, because the child is moving schools into middle school, it will be interesting to see whether they get that whether they hurry it up. That one's moving a little bit faster, I think, and I think we will come to some form of resolution or some form of I don't know, the compromise is the right word, but some form of agreement between the school and CDPH and our side. So hopefully that won't take us long, but I if we lose it and go to an appeal, then yes, it will take longer. What is the timeline for SB 277 lawsuit? That's the 2 to 3 years. So the SB 277, the religious exemption lawsuit, is likely to take 2 to 3 years. It'll probably take a year for the firsts, or in the lower courts in California, it will probably take a year to, unless it's outright dismissed, which we hope it won't be, but if it goes through the full process, it'll take a year here, and then it'll move to the appeal court and then to the Supreme Court, and if it goes that far. And the thing is, even if we win it at whatever level, we anticipate that CDPH will and the California government will fight it and appeal it. So we don't anticipate either side being okay with losing. So that's why we think it will take longer. How do you opt out of the vaccine registry? So I went through that. If you need to go, if you search California Immunization Registry lock records, the form should come up. It's also on our website. So if you go to A Voice for Choice Advocacy, go to Empower Yourself, click on Empower Yourself, and there is one of the sort of topics there is lock your immunization registry, and that has a link to the form that you need to fill out. Okay. What is the likelihood as California goes, so goes the rest of the country when it comes to the effects of these bills your group is sponsoring? We are avoiding going to Cali with the kids. So it depends on which ones. On the positive ones, for example, the bisphenols, it's very likely. You saw, our legislation that labeled the ingredients on menstrual products, that other states didn't even have to have that law in place in order for it to happen, because manufacturers did not want to make one product for California, one product for New York, and then have a different product for the rest of the states. It's just easier for them to create one product for the whole of the United States and just label the ingredients on it. For something like the bisphenol bill that we have, it is likely, again, that the same thing happens. If they're banned from making products with bisphenol in California, it's very likely that that will carry over to other states. So on the, there are two areas that California does well. One of them, in our mind, one of them is this getting the toxics out. So there are a lot of PFAS bills, for example, that remove the forever chemicals, which are these PFAS chemicals. And that's something that we actually see happening sort of on both ends of the spectrum, on a federal level and on a California state level. And, we anticipate that will become a full federal ban on PFAS I hope in the next 5 years, but I think more realistically in the next 10 years. But manufacturers know that there's crackdown coming on that, and they are changing their products to be PFAS free. The hope is that they don't do what they did with the bisphenols, which is replace the forever PFAS chemicals with something that is just as bad, but hasn't been determined to be that bad, or isn't on people's radar yet. On bills like the vaccine laws, we did see, after California passed, we did see other states, Maine and Maine and Connecticut and New York pass those bills. So I would say, I think those bills and other bills in California that we perceive as bad bills, I think in blue states, they're more likely to follow suit. Purple states, sort of half and half, and when you get to the red states like Florida and Texas, they're not following California at all. So, I think if we get a win, for example, on our lawsuit with the SB 277, the religious exemption, I think that will trickle over, and we know that the other states. So we know that Connecticut, West Virginia, Mississippi already got that religious exemption back, but some of some of the other states that haven't got a religious exemption right now, that they will also, they have lawsuits either active or they're going to have lawsuits. And I think that will be a push. My guess is some of these will make it to the Supreme Court, and we will get a ruling from the Supreme Court on that. And that would be it would be great to have that ruling so that any other state that considers this knows that they have to keep a religious exemption. And that would be the ideal answer to this. Okay, next question. Johns Hopkins wrote an article and stated that some of the PCR tests had the vaccine and I think graphene oxide. Are any of the kits being tested? So many think that unvaccinated could be vaccinated or have unwanted contaminants in their body. If any of this is true and the PCR test hid this information, they should be liable in some way. Will we see these cases? Thank you so much for your great work. So it's an interesting question, and we kind of went down this road during COVID. One of the great things is that not many people are requiring COVID tests anymore. But when that was the norm, to be in school, to be at work, to travel, those types of things, our perspective was, do not do the swab. Don't stick a swab up your nose. If you need to blow your nose and stick it in the swab, is it 100% effective? No, but these PCR tests aren't 100% effective. As for the graphene oxide and a vaccine being it, I just, the graphene oxide is one thing, that's a component, and that's the reason I would, I personally, they definitely had something on them, right? Okay, so in the liquid, if you look at a box of COVID tests, it says, do not get this on your hands, do not get this in places. So, to me, I don't want to be sticking anything up my nose that I don't know what's in it, and that could potentially be harmful. But at the same time, do I think they had vaccines and that type of thing in it? I don't think so, because they weren't making enough money off them, and they were giving them away for free. So I don't think so. I mean, will we ever know? Probably not. But I just, to me, I don't think the COVID tests were, if I had to do it, and I've done enough research on the COVID test, my gut is, did they have crap in them and toxic chemicals in them? Yeah, most likely. Did they have, was it just a cotton swab on that swab? Probably not. But that's where I'm like, I don't want anything stuck in me in any way, shape, or form. So, but I don't know that they were, I'm going to say, nefarious in what they put on their swabs. Could they have been? Yes, they could have been. But as I said, I wouldn't put anything on it. The question are they liable? No, they're not. I mean, they're not liable. They would fall under the PrEP Act, which is the CICP, which is any EUA product that you're harmed by, you can go to the government and ask them for money. There have been, I think, 11,000 requests for the vaccine injury in that, and I think 3,000 have been looked at, and it's a couple of hundred handful that have actually gotten money, and the money they've gotten is ridiculously low, is in the thousands. And so it's not a way to get compensation. But is there any way to sue them? No, you cannot sue a manufacturer for an EUA product. Another reason to not use EUA products until they become FDA approved. And I don't think any of the COVID tests actually became FDA approved. Like, I think most of them got their EUA approval, made their money, and are out of the business and on to the next business. Okay, next question. I was wondering, where is the state of California in the process of allowing children not having been vaccinated to attend school, and where can we access data on this care registry? Where are the forms? So I kind of answered that question. I'll answer it again. So in the state of California currently, you have to, in order to go to private or public school, you have to be vaccinated for 10 different diseases, and you have a checkpoint at kindergarten and 7th grade, but that doesn't mean to say the schools don't check every other grade. You have to be fully vaccinated unless you have a medical exemption, and a medical exemption is basically impossible to get. Even if you get a doctor to submit it to the CareME system, it is likely to be thrown back at you, revoked. And even if you appeal, the likelihood of having your appeal accepted is very low as well. The acceptances that I've seen are for oncology patients. So kids are going through cancer, or if a person in their household is going through cancer and they can not have the live vaccines, then those live vaccines can be given a temporary medical exemption until they've gone through, chemo. Or the other place that I've seen it is if you have and this is where the titer testing works, if you've had chickenpox and you've had one dose of the vaccine, that seems to pass you by, or get you approved for just the chickenpox vaccine to have a medical exemption. But you have to have had both the disease and one dose or two doses to get. If you're two doses, then you're up to date, considered up to date. But if you have one dose in an antibody test, or one dose or the actual disease in an antibody test, that is not good enough. Unless you have, like, if you get it, it'll be revoked. And if you have for your chickenpox, if you have a picture of so if your child gets chickenpox, document it and go to the doctor, although then you've got CDPH coming after you because you've got a contagious disease and they're going to want you to quarantine, etc., etc. But if you go to the doctor and you have pictures taken showing that it is your child and they're the ones with the chickenpox, and up close saying, yes, it's documented as the chickenpox, then you may be able to get a medical exemption. But that doesn't hold true for, most other diseases people don't have. So just getting antibody tests, and you do, for many of the diseases, you do get the antibody, you get titers and antibodies from having one dose of the vaccine or two doses of the vaccine. You don't need all of the doses of the vaccine. But yeah, so, and then the other place that you can not be fully vaccinated is if your child has an IEP, which is an individualized education program, which means that they have special needs and they need services in school. So either occupational therapy or, to be in a separate classroom for some of their lessons, those types of things. Then your child does not need to be fully vaccinated. But otherwise, you have to have your child fully vaccinated. If you homeschool or do independent study, those are areas where you do not need to, your child does not need to be vaccinated. And I will say, from the independent study perspective, the independent study, when SB 277 started, you could only do independent study for a year out of your whole school life. With COVID, they expanded that to be, you can do independent study your whole school career. And so that makes it a little bit easier on parents to have, if you want your kids in public school, to have that structure. That's it. And I will say there are learning centers that take in, if you need coverage for your children, there are learning centers that will take children in who are being homeschooled, who, to basically take them and have a space for them to learn in a overseen, monitored way. Okay. Can you share any stories of people having their physician filing an ME and it being rejected, and what grounds for rejection? So I would say every ME, except for the oncology ones, are rejected. Hands down rejected, even if they have a good reason. The interesting thing I will also say is, when you read the law, it says that a physician all MEs will be reviewed if a physician writes more than five or more medical exemptions. What it doesn't say is that they will only be reviewed if they write 5 or more medical exemptions. And what we've seen is that CDPH reviews, or it's not actually CDPH, it's a third party that they've hired, which they're allowed to do. It's a third party that they are reviewing every single medical exemption that gets put into the CARE ME. And their initial reaction, unless you are, you are an oncology patient or in the family, or if you, for example, have if it's a temporary medical exemption for something, so for example, you for some reason can't get a vaccine. Most of the time it's things like oncology, but if for some reason you can't get a vaccine, that dose, and you're postponing it by a year maybe, then they may not. But I would say everyone, has every one of the medical exemptions that I know, and it's very, very hard to get a doctor to even put a medical exemption into the CARE-ME system. But everyone that I have heard from they've been overjoyed and been like, oh my gosh, we got a medical exemption. And then 2 weeks later, it gets revoked. And once it's revoked, you have 30 days to appeal. But, if you don't get that medical exemption, your child is out of school. And so what I say is, even if you have a medical exemption on file, you have to have a plan B for your child. You have to work out, what am I going to do if their medical exemption is revoked and it gets appealed and the appeal doesn't go through. The problem is that you cannot get a medical exemption blanket. You cannot get a medical exemption for all vaccines permanently, because the reason that you can get a medical exemption is if you have a contraindication or precaution to each individual vaccine. And you can only have a contraindication or a precaution for most of the vaccines if you've had one dose of that vaccine, or at least one dose, and you've had a reaction to that dose of the vaccine. So you have to be able to prove and doctor documented at the time, which is also very hard to get a doctor to actually admit that it was the vaccine, but to show that each vaccine you've had a reaction, or your child has had a reaction to, and therefore they can't have that vaccine again. And so, you may be able to do that with one, maybe two vaccines, but you certainly won't be able to get it across the board. Will the tighter lawsuit also help others who want to use titers? Yes. So that is our goal. Our goal with both of the lawsuits on SB 277 is, if we win for the families involved, it will also apply to anyone in California, because what it does is it sets precedent. So if your school won't allow, our hope is, we get this passed and CDPH acknowledges, yep, titer testing, you don't have to put it into the CARE-ME system. You don't have to have a medical exemption. You can just bring with your vaccine record, you can bring your titer tests, and the school will accept them as that. But you don't, once we've set precedent for that yes, that is the way to, this lawsuit won, then any other lawsuit after that will just say, you allowed it here for this child, we want to do it as well. And the judge will look at it, and rather than go through the whole process again, we'll say, well, that lawsuit got adjudicated and said, yes, titer tests are good and you can use them, and then just base it off of that. But most schools, and I will say most do, but we've seen with the IEPs where schools over and over again, same school districts even, go to court and lose on their children not being able to have an IEP and not be vaccinated. And they Educate Advocate is an amazing organization. They've been fighting this all along, and they have, they've won over and over. And as I said, even in the same school district. So I don't, maybe not the first one, maybe there'll be a few more titer testing, but the more that we have go to court and win, the more, it will become the norm that you can do that. And that is our goal. Our goal is to do that. The same thing with the religious exemption. If we win the religious exemption with these three plaintiffs, it will set precedents in California that hopefully the state will put forward a religious exemption for everyone to use. Does anything get approved in the lower courts? So in California, on issues like this, not very often. Our legal system is, and I didn't think this when I first got into this, but I definitely do now. Our legal system is as biased as the legislative system. In Missouri, they won in the lower courts, and just based on the lower courts, their public health department put out a religious exemption and allows everyone in the state of Missouri to have a religious exemption now. But they're a very different state to California, have very different judges to California. So the California judges are mostly Democrats. They are, they're just different, and they're Democrat based, and they much more feel that you have to do things for the greater good than you have to do things for individual choice or parental choice. Okay. Are you working together with Free Now Foundation in the religious exemption lawsuit? We are not. So we are just doing this lawsuit ourselves. They do not have currently a lawsuit on the religious exemption. I believe they haven't put it forward yet. They haven't filed it yet, but they're looking to do an exemption on the medical exemption, specific to the issue of, medical exemptions being basically obsolete here, and that even a child with basically their argument is what it was between 2016 and 2019, which is it should be up to the discretion of the doctor to write the medical exemption, and it shouldn't have, CDPH overseeing it, and questioning whether, this is legitimate or not. And so they have not filed that lawsuit. They've said they're going to file it. We'll see when they do file it, but we are not working with another organization on our lawsuits. We're happy, if other organizations want to file lawsuits on the religious exemption, our perspective is the more the merrier. So, if there are other, as I said, there's one other organization, the Advocates for Faith and Freedom, that have a lawsuit that's very similar to ours. Ours goes sort of into more depth, but theirs was dismissed. I believe they're going to appeal that dismissal. So next question, what are the reasons for locking our vaccine registry? So if you don't lock, so let me be clear, if you have data in the vaccine registry, if you don't have data in the vaccine registry, I would just leave it be and not flag yourself because you're not in there, or your child's not in there. The reason for locking it is that if you don't lock it, schools can access it and get the information. Now, they should get the parental consent to access it, and some schools will ask you to sign a piece of paper saying that they want to access it, and will you allow that? Other schools, both public and private, I have seen in their sort of contracts, they, put a blanket statement that we will access and we will share information not specific to vaccines, but information. Do you agree to signing that? And basically, you sign it, and you haven't really known that that's what you're signing away, but that is what you're signing away. Unfortunately, also with going to things being electronic, it is very hard to say, it used to be when you got a paper contract, if you don't like something, you can cross it out and sign your initials, and that no longer is valid in that contract. Unfortunately, with things going digital, if you don't agree with something in the contract, it's very hard to have it taken out, because there's no way to just say, I sign on the bottom line, but I don't like this piece of the contract. And so you can still, I believe, print it out, and you can do that. But many of the schools want you to do it on their health system website or their contract website. And so they don't give you that option. Okay, next question. Do you know of any other personal lawsuits that are successful at keeping students in school that are not vaccinated or stopped due to reactions and no longer have a medical exemption? I do not. I don't think, it's a, I don't know of any others. And when parents come to me and say, I want a lawyer to do this, my answer to them is, okay, but it's going to take 2 to 3 years. You're not going to win it on the first level, and you're probably not going to win it on the appeals level. And, the Supreme Court, both the California Supreme Court as well as the federal Supreme Court, only take 5% of cases. So the chance of it even being heard at that level is unlikely. And so I have not seen I haven't known of any lawsuits, let's put it that way, because I don't think they're winnable. The law is the law. We had a lawsuit there were 4 lawsuits when SB 277 first came out, and none of them were successful. We had one of them. We based it on all things that we thought we would win on: bodily autonomy, parental rights, and free and public education. And we lost because one of the judges in the appeals court was so emphatic that if they allowed this lawsuit to win, even though it was based on those 3 things, it had nothing to do with the vaccines, and it was that polio would come back. If he allowed this lawsuit for us to win it, polio would come back. And they're not logical thinking, and they're not legal thinking. if we had that lawsuit today, I probably would have said, let's take it to the Supreme Court, because the Supreme Court is very different than it was 10 years ago. And we have much more favorable. But that's part of the reason we went with the religious exemption, because we do believe if it comes before the Supreme Court, and that's a big if, but if it comes before the Supreme Court, that the Supreme Court would rule that, yes, there has to be a religious exemption and uphold the First Amendment rights. Next question. When will the chickenpox vaccine go off the list of required vaccines for the children's schedule in California? I don't think ever. The vaccine is the vaccine. It's recommended by ACIP, the federal level vaccine recommendations on the children's schedule. I don't think it will ever be removed. You know, it was a vaccine that was created for convenience, and so that parents didn't have to stay home for 2 weeks and kids didn't have to stay out of school for 2 weeks. And that was what it was billed as. That was what it was, you know, brought forward as. But I don't think it will be taken off the California schedule or off the, you know, the federal schedule, because it's a moneymaker, and the pharmaceutical industry is what drives that. Okay. You mentioned the Orange County lawsuit is another advocacy group that filed for a similar suit to yours. You said it was also almost dismissed. Are they still fighting it in court? If so, did they have a chance? So it was dismissed, but with a leave to amend. And so what the judge basically said to them is, you don't have a good enough case here, but I see a way forward that if you amend it and you include this information, then it will move forward. You know, then I'll consider it, and I won't dismiss it. And so they did that. The specifics, one of the specifics was that the plaintiffs, the people in their lawsuit, they had said that they had a religious belief against vaccinations, but they didn't clarify that or say exactly what that belief was. And so that's the reason we also pulled our lawsuit back, because we had not done that either. And we knew that if we didn't do that, that likely they would do the same to us and say that it wouldn't be valid. And so we pulled ours back. We're getting those statements from our plaintiffs, and then we'll put it forward again. So that's the main reason why it was dismissed. But they are going to amend it and put it back into the court system. So I think, you know, they will move forward. I think it does have a chance. You know, I will say that we went into more depth in our lawsuit specifically because we wanted our lawsuit to have a better chance. But I do think both of them will move forward, at least to the next level. Okay, this is the last question. It says San Jose State requires hepatitis B vaccine for off-campus students. Would you think that the only way out of this is a religious exemption versus a medical exemption? Yes, and I would do a religious exemption over a medical exemption. A medical exemption has a lot more latitude to be denied, and it's hard to get medical exemptions, as I explained. A religious exemption is I'm not going to say much easier. You do have to have sincere religious convictions against vaccination, but if you have those, it's much harder for them to deny it, because they can't question your religious beliefs. And if you need help with that, if you go to our website, under Empower Yourself, there's a religious exemption workshop. I did those live during COVID. I did probably 100 of them live during COVID and helped thousands of people. I think we helped over 4,000 people get their religious exemptions mostly for work, for the COVID vaccine. But we've helped people with green cards, and we've helped people with school, you know, college religious exemptions, and we haven't had one single one be denied. You know, if you know how to do it, and you have to write your own religious exemption, no one else can write it for you. But if you write your own religious exemption, it is unlikely to be denied. You have to write it well, and you have to think about what your religious beliefs are. But if you do that, you can definitely get one. I'll end this by saying there are two areas. So the green card issue, if you have anyone that's needing a green card and does not want to be vaccinated, please send them our way. I was helping a couple that didn't do that, and they filed their own green card. The other thing that's unfortunate, but if you have a lawyer for a green card, it's much more likely to be approved than if you don't have a lawyer. It's very unfair, but it is the way of our system. It's a federal system. But specifically, many green card immigration lawyers don't know the religious exemption piece. If you know people before they submit their green card, for them to have a religious exemption. And key piece there is that the COVID vaccine is still required for your green card. You have to have 2 doses of the COVID vaccine in order to get your green card. So if you have anyone that doesn't want to do that, send them our way. I don't have that on our website yet. It's sort of one of these dicey issues that you don't want to make it too public, but I am going to put something on our website regarding the green card and your options and what you can do in order to file your green card. So I would say that's one area that we definitely have been helping people. The other area that and that area, I would say we're very successful. The other area that is really hit or miss, but I'm happy to give a lot of advice and help for free to people, is the vaccine custody issue that we're seeing more and more, where one parent, you get your both parents are on board, and I've had personal experience with this. Both parents are on board with not vaccinating their children. They get divorced, and one person, usually the dad, but I've also seen it the other way around, but the one parent gets fixated on vaccinating the kids because they know this is the sore point for that other parent. And it's really hard, especially in California. It's really hard because we don't have a religious or personal belief exemption. And so the only option that they have is a medical exemption, which is impossible, and therefore homeschooling. If you can stay out of the family court system, I highly recommend it, because the family court system is the worst system out of all the legal systems that I have ever experienced. It is geared towards the narcissist. It is geared towards the parent that is mainstream. And even with parents, during COVID, we had a bit more luck because the COVID vaccine was not required for school, but it is a hard one, and you need to be, and also depends on the age of your child. So if you've got a child that's 5 and under, it is much, much harder. If you have a teenager, it's much, because the teenager has a say in it. It's much more up to the teenager than it is the parents, really. So anyway, that's another area that I'm happy to help people with. I won't say that there are a huge number of success stories, because the court system is so messed up. Okay. Next question. A resource for no college mandates has a spreadsheet. Yep, that is on our website. So if you go again to the Empower Yourself, there's a college vaccine mandates, and we have a link to the no college mandates website, their spreadsheet of which colleges have vaccine mandates and which don't. So highly recommend that as well. Okay, we got a few more questions, so I'll keep going till we have no more. If you had a school vaccine out of state, how does our state see that you had it? So I'm assuming if you go somewhere else and you have so you can print out you can get from I understand the question now. If like, for example, if you got a vaccine in Utah, you would need your Utah doctor to print out or sign the yellow card, but show that you have the vaccine, and sign off on that, and then bring that to your school, and they'll accept it from out of state. They'll accept it from out of country too. If you are not in an English speaking country, then you will need it to be translated and officially notarized that the translation says that your child got those vaccines. But you can do it from out of the country as well. Okay. I think those are all the questions that I got. I appreciate your questions, and thank you. I just wanted to say thank you to everyone. If you appreciate the work we're doing, I would, ask for a donation to a Voice for Choice Advocacy, or a Voice for Choice if you need a tax donation. I don't get paid anything for this. I do this out of the goodness and my passion of my heart. But we do have a team of writers that we pay, and we have a team of our legislative director, our grassroots director, our social media person, our managing editor. And so that's where the money goes to, as well as our lawsuits, or as well as our legal team. So I would ask that you donate there to a voiceforchoiceadvocacy.org, and you can choose, if you go to the donate button, it takes you to where we have both options of donation. So I thank you, everyone, and I hope you have a wonderful evening, and take care. Thank you so much.